Talipes equinovarus or clubfoot is a condition in which a baby is born with his or her feet pointing downward and inwards. It is twice as common in males as compared to females, and the proportion is 2:1. It may affect one or both feet. 50% are bilateral, that is, it affects both feet. This may be isolated, that is, it is the only problem the baby has, or it may be associated with other problems which may be genetic, chromosomals, or abnormalities of some other parts of the body. What causes clubfoot? In most of the cases, the cause is unknown. There is, however, a familial tendency, means some members of the family have this genetic disorder. It may also occur in the combination with other abnormalities. The associated structural abnormalities include poorly developed hip joints, spina bifida, the joint problems, or the muscle weaknesses. What tests are done to find reason for this abnormality? In small number of the cases, the baby may have chromosomal abnormalities. A patient may be offered test to check the type of the chromosomes, and that test is known as amniocentesis. Does Talipes equinovarus happen in the next pregnancy? The chance of having another baby with a clubfoot is about 1 in 25, that is 4%. In 1 in 1,000 cases, there is a chance that no other family member is affected. There is 3 in 100 chance of any other family member being affected. How to manage Talipes equinovarus? A patient is referred to fetal medicine consultants who scan the baby to make sure that there are no other abnormalities that have been missed. After chromosomal study and the detailed scan, an orthopedic surgeon will explain what will happen to the baby when it is born. How is the baby with Talipes equinovarus delivered? Clubfoot is not an indication for the cesarean section. The baby is delivered normally unless there is an obstetric reason for the cesarean section. The different types of the clubfoot include Talipes varus, Talipes vulgus, Talipes equinovarus, Talipes calcaneovulgus, Talipes calcaneovarus, Talipes calcaneovulgus. Talipes equinovarus is one of the fetal anomalies. Here we have list of other fetal anomalies which include anencephaly, hydrocephalus, spina bifida, encephalocele, the cardiac anomalies, the renal anomalies, GIT anomalies, the torch infection, twin pregnancy, abnormal knuckle translucency which occurs in the Down syndrome, epilepsy associated abnormalities, diabetes associated abnormalities, the effects of the different drugs, cystic hygroma, omphalocele, gastroschisis, exomphalos, congenital diaphragmatic hernia, meningomyelocele, duodenal hernia, choroid plexus cyst, echogenic bowel, holoprosencephaly, ventriculomegaly, congenital pulmonary airway malformation, cleft lip and cleft palate, the fetal hydrops, duodenal atresia, Carey malformation, and the Porter syndrome. In holoprosencephaly, there are monoventricles which are dilated. There is fused central thalami. Here we can see the normal and hydrocephalic baby. The spina bifida is shown here. Here we have encephalocele, fetal cardiac anomalies, fetal renal anomalies, and the fetal GIT anomalies. This is the Porter syndrome, in which we have bilateral renal agenesis or bilateral multicystic dysplastic kidneys. As a result of that, there is a reduced fetal excretion of the urine, and that results in oligohydramnia, which cause the fetal compression. There are also the Porter facies in the Porter syndrome, which include the low-set ears, the beaked nose, the prominent epicanthic fold, and downward slant to the eyes, pulmonary hyperplasia causing respiratory failure, and the limb deformities are also seen. Here we can see the fetal Down syndrome. The different features include absent nasal bone. There is also thick knuckle fold of more than 6 mm. Fetal echogenic bowels are also seen in the Down syndrome. Here we can see the abnormalities in the number of the fingers, and that vary from simple incomplete to simple complex, then to complex and complicated cases. So thank you so much. That was all about Talipes equinovarus, and also I have explained some other fetal anomalies, and one by one in different types of videos we will explain these anomalies, and in one video we will explain all these anomalies as a whole as well. subscribe on Obs and Gynae. Thank you so much. Allah Hafiz.